Nice to meet you, Reed, by the way. I'm
Yeah.
John.
Hi, John. I'm Reed. I work at NTC in Wausau. So,
Awesome. I've heard good things about the work you're doing. Really
oh
appreciate you
yeah,
joining us today. This is great.
yeah,
Fantastic. I've been looking forward to meeting you.
yeah. I've seen some of your stuff on LinkedIn, so I try to follow some of the VR stuff on there. So,
Cool.
yeah,
Excellent.
hmm yeah,
Well, so that I don't butcher it, why don't you introduce yourself and we'll just jump right in. I'm really anxious to look at the unit you built and have you kind
sure,
of talk us through kind of what you're doing with Acadicus at your facility.
sure. So I've been in this role. My title changed just recently. I got to remember what it is. I think it's Manager of Health Education and Technology. So I manage our VR lab and um, our immersive reality lab and various other like our Pixis recording system, some other stuff on our sim center for all of our health programs. Right now, it's really nursing is really more utilizing a lot of this stuff just because they have the largest program, but CNA is kind of getting involved and dental a little bit, and hopefully we're expanding it more. Um, so I believe I operate similar to some of the other people at the other colleges where, I facilitate the simulations for VR, build some of the stuff, we utilize the OER stuff too. But for both, for VR and then immersive, I build it all in that program and facilitate. So, and I've been doing this for a year, and then I just finished my master's for nursing education, so we're doing some stuff with like evaluation with VR now, but from my end, and I do adjunct clinical education for nursing. So, um, yeah, so I was over winter break, I was semi-tasked, but I kind of took this on myself. Um, the clinical makeup, like if a last nursing semester student missed a second clinical day, they had this makeup in place that wasn't really like engaging and beneficial. It didn't really replicate a clinical day at the hospital. So I brainstormed some stuff with our fourth semester faculty. And I was like, well, I could probably build something in Acadicus to replicate something along the lines of what you're looking for. So what I ended up doing was I took the 4-bay respiratory that Rick had shared with me at one point and took those bones, kind of pretty much took everything out of it and replaced it with the stuff that I came up with. So we basically had to build 4 sims from scratch, which took a long time. I had help. It wasn't just me because we had to make like all the H&Ps, all the MARs, all of the orders, all write out all the reports, and then type them up and transcribe them and embed them and stuff. So that took a long time. But do you want me to share my screen?
Please,
Yeah, that'd
yeah,
be great.
Sure.
really
So
looking forward to the tour. And I'm in there with you too, so you'll
I
see
saw
me.
that. Yeah.
And
Okay.
before we jump in, I just wanted to introduce you to Bill Ballo. If you don't already know Bill is the XR lab administrator at Madison College.
We've
He's
Oh,
spoken
Reed
over
Champagne from
email a couple
NTC.
times, but
Yeah, we
and
have.
it,
Great. Okay, cool.
we had intentions of meeting this summer. We never got around to it, but
Yeah.
hi.
Nice
Excellent.
to see you,
Excellent.
Reed.
Yeah. Okay. So I'll show you the experience first and then like the documents that go along with it. So we have the 4-bay room, of course. And the purpose of this experience is to have the student, because our 4 semester students take 4 to 5 patients during their clinical day. So I wanted to make sure there were enough patients overall, but also the purpose of the experience is mainly for them to, treat this as a normal clinical day and prioritize their patients and respond to changing patient dynamics and deterioration and stuff like that. So we have backgrounds and stuff, like I said, for all the patients with H&Ps. The student will look up their patient before the sim without the headset, so they have the chance to write stuff down and whatever they want to do. And then I gave them report before, but I also put the report recording in here, so if they wanted to go back and listen to it, they could, but it's also in the room as well, transcribed. So I tried to make it as much as like a prep to a clinical day as possible. And then, similar to some of the OER ones where they follow like different stages where like they do one thing here and then the next scene something else happens. Um, for example, like this first person is supposed to be discharged. So they're just supposed to assess them quick and probably not get to them because other stuff happens. And then this second person had a surgery in which they're receiving IV antibiotics, and the main goal for the student in the first stage is to assess them and give them their IV push ampicillin. This next person is here for some liver issues, and they end up crashing in the second stage. But in the start, they're one of the more stable patients. They just want to go take a nap. But what happens is that they're getting their IV albumin, and they were supposed to receive furosemide after their last dose, but they refused it. So they end up having flash pulmonary edema in the second stage after they wake up from their nap, and the patient deteriorates and the student has to respond to that. But that doesn't happen right away because we have this person over here who has symptomatic bradycardia waiting to get a pacemaker, and their goal for the first stage is to get them off to the procedure because the nurse before didn't have time to call the OR. So it kind of follows like a script to a point, which I'll show after this. But it's kind of dependent on the student's actions. So that was another challenge, was to create all the different avenues that it could go based on how the student responds. And we've only been able to test it a couple times. We worked out some of the kinks already, but we haven't used it with a student yet because they just came back, and nobody's missed clinical yet because they haven't even started. So yeah, I was able to make, like a general med station over here with all of their meds, because the easy thing I think would have been to put all their meds in their rooms, but I wanted to simulate it like they have to go to the Pyxis, like at the hospital, and go gather the meds and bring it back to the room and actually look through them. And some of them I made larger just like so they could see them easier, like the vials and the insulin pen. And then I have like a little station for supplies over here or whatever. But yeah, so the purpose of this is that they are in a unit just like they would be a clinical, assessing all of their patients, changing priorities, and then I don't know if there's capabilities to do this, but like when this last patient goes off to procedure, I'm just like, okay, we'll just pretend that they're not there. I don't know if there's like a way to
Oh,
get
and
them
remember,
out.
Reed, one of the reasons we connected with each other was because there were things I wanted to show you that we had new.
Yeah.
So we'll get to that after you're finished.
Okay. Awesome. Yeah. Because the same thing happens with this third patient because they deteriorate and they get transferred to ICU. So they end up not being there in the end. But that's the overall plan. It's kind of a lengthy. I tried to make it like realistic for the student because it's not realistic for a student to be in the headset for 3 hours, right? So the plan of action was to have them do the first stage, all their assessments, their initial med passes, and get that patient off to surgery. That's the one that has so far by far taken the longest because they have to spend the most time with each patient. And then they go on lunch and they take like a 10-minute break out of the headset, gives them time to write some stuff down if they want to jot down notes or whatever. And then they come back and the patient crashes and they go into stage 2 and stage 3. So we're still trying to figure out like the timing and everything for that. But that's where we're at right now. So that's the experience itself. And it's come along, like I started with just the patient and then I added, the report and the MAR, so when they give the meds, they don't have to go outside the room or whatever. They can just look up from the side so it doesn't interrupt with the flow of the thing. And then I remembered that these panels exist, so it makes it easier from the facilitation standpoint where the student can just sit them up or take the gown off or whatever. So I put those in, and then every room has their assessment tools in there. So that's that.
That is fantastic, Reed. My goodness, this is
Yeah,
amazing.
this is awesome.
Absolutely amazing. Well done.
Thank you. It like this part took a while, of course, because we wrote the story, like the background and the bones of the Sims first, and then I jumped into this and did this on my own. But then like we didn't really have the Sim stuff done, so I kind of had to go back and redo a bunch of stuff. But this is where we ended up. So yeah.
Yeah, it looks great. And you said
Yeah,
you'll
it
be
really does.
testing it with additional students over the course of this semester?
Yeah, I'm hoping that it's tricky because the student population this one is aimed at least is like our almost completed, like our last semester nursing students. And I don't want to take one of them and then they end up missing clinical and they actually need to do it and they've done it already. So
Oh yeah,
I,
yeah,
I'm
yeah.
I'm we kind of have to wait until a student like actually does it. But we have like, so the two that we used to test was two of our faculty that were fairly adept to our VR stuff, to actually give meaningful feedback. So I think I'm going to grab probably another faculty and do another run through a different one. Since we've made, because like the first time I didn't have the panels in there and I didn't have all the assessment tools appropriately so they can grab them and stuff. So I found all those errors and we corrected them. So I'm hoping we can get it to a point where it's seamless.
It looks like you have the return sockets for most of the assets, so you could almost do this in non-VR mode if necessary. Is that consistent with what you're planning on?
So our idea was for to have them do it in VR, but something that we don't know yet is like how a student who, because from my experience, not every student is super advanced at VR, functionality in general. So we're gonna have to see like, because it's going to be a required part of their clinical, and I'm evaluating on their clinical eval for this. So we're going to have to see like, okay, well, what if they can't tolerate the headset? So I tried to make it, adaptable to use non-VR if possible, but the goal is to have them do it in VR, so they actually
Mhm.
have to move around and stuff and whatever. So, but yeah, I put all
Excellent.
the sockets in. I don't know if I did the medications right with the sockets, but all the tools and stuff I did. So
That's excellent. And would you have the students go through the orientation? I would imagine the tutorial in the beginning to get them up to
yeah.
speed with VR. It's probably a good way to get them on board.
So what we've started to do now is, so before I was in this position, and I came into this position a year ago, we had all this stuff, but there wasn't a faculty that was like leading it. So students weren't consistently doing the orientation or the quick start at the beginning of the program to get their feet in, and then by the time we actually do stuff, it's not like they're relearning it every single time.
Hmm.
So this semester at the new student nursing orientation, we brought them in there and we did the quick start orientation just for that. And then
Great.
I believe they're going to do the hazard OER experience. So like another kind of intro one
Hmm.
in first semester, and then they do the head to toe assessment in here. So hopefully, it's going to take a couple semesters, but by the time like we actually really get it refined and stuff, the students will have been in it 3 to 4 times per semester, and they equipped, should be equipped to do it.
Excellent.
So
It's a
yeah.
great plan.
hmm I guess, do you guys have any questions about the catechist portion?
Was there anything that you found the most challenging with the platform? And I like this kind of feedback because it helps us continue to refine how we make things. And in fact, I just got some great information from our developer just the other day about some new functionality he's bringing that
Mm,
I wanted forever,
yeah.
about locking resources in once you have them in place.
Mm,
Because I've thrown beds on the ceiling too
yeah.
many times.
Did that plenty during this. So um yeah, no, I mean, there was, I think mainly because like I said, we wrote the sim first without basing it off of the assets that were available. So there were some limitations as far as like assets go. So like, for example, initially, I think we wanted this cardiac patient to have atrial fib with RVR. Um, and we wanted them to be like on a cardizem drip or something like that, but there wasn't a cardizem IV bag that I could create, or just like smaller
Mm,
limitations like that. Or I think I couldn't find a vitals monitor that I was able to show sinus bradycardia on, except for this defibrillator, I think. Um, so that was one, and like I can't toggle the vitals to this one because it's not the one that snaps above the patient, the vitals monitor. So it's a little bit more strenuous on the facilitation end, but it shouldn't be that bad. I don't know. Overall, I think it's just like some of the asset limitations that was the biggest thing. Like, because for example, this person has like the liver, decompensated liver failure, and one of the first questions the faculty asked was, why aren't they jaundice? But I don't think I can make them jaundice. I couldn't find it, at least in the Gen 2 patients. So
Double check that on the sim manager. under skin. I think it's under skin and appearance. Let me see. Under yeah, that doesn't make. I thought we had jaundice in there.
I thought so too. I wonder
You
if it's
know
not
what?
this patient.
For is it who is the one that we used? It's the is it the one we used in the GI bleed and the cirrhosis? That's
Oh, the cirrhosis of the liver, not.
yeah,
There,
it's
Oh,
the one I use for Carl Shapiro. Let me see if I can find it in mine and I'll show you.
because there was a preset one, I think, but then I don't know if they had all the same sim manager options.
oh, it's not a full
Yeah.
Gen 2.
So
Was it
that's why I
the
didn't go with those.
Let me see. Let me see. I swear I have one that goes jaundiced.
Is
Let me
this,
just
is this Gen 2 from the alcohol detox?
Yeah, I think this is Medical College of Wisconsin, the one that they commissioned.
Yeah, we also use her for opiate. Um, because the opiate sequencer synchronizes with her.
Hmm.
So
Yeah, I think I initially started with I must have pulled some of like the OER Gen 2 patients, but then they didn't have some of the all the sim manager functionalities that I was looking for. So then I just pulled the general Gen 2 and placed them all in
gotcha,
there. So
gotcha.
yeah.
Let me
And
see.
then
I'll go ahead.
read to your earlier point about needing to use the defibrillator because you're looking to have a tracing of AFib.
So that was the initial plan, and then we had to pivot. So now she has sinus bradycardia. Um, there was off the top of my head, I can't remember, but there was a reason why I couldn't use the main monitor. I don't think because I don't think you change
Yeah, go
the
back to that last patient that you were talking about with the jaundice, because she has one over her head, right?
I believe so, yeah.
And if you go to Sim Manager,
And I found the patient who gets jaundiced for you as well.
Okay. Um, so yeah, because this is what I'm seeing on my end with this monitor at least. I thought this was the only one that like locks in
but if
to
you select the patient
okay.
and then, yes, sir,
Under the vitals tab,
is it vitals?
it should be.
No, I think
No, it's not. No. Yeah, this is why I did
circulatory
this with Carl Shapiro.
Circulatory?
and
Yeah, because I know you can do
scroll.
the sounds, and then this is like the pulses and
Yeah.
stuff.
No, it doesn't have the waveform changes except for rate. This is
So
why I
if
did
we,
this with Carl Shapiro. Yeah.
hmm, so if you change these sounds, then the tracing doesn't change, right?
No, because that's just like you can say atrial fib, but that's just it sounds irregular then.
Mhm.
It's not
Yeah.
like the actual
But
rhythm.
yeah, the actual tracing doesn't change.
Yeah.
Gotcha.
So
Reed, do you
that's
mind if
why
I
I
share
went with
my
this.
screen for a
Yeah,
second?
yeah, sure. Go ahead.
I'll just do quick share for you.
I told you you'd have the
So
brain trust together here.
this is
Yeah, we're all geeking
so
out.
this is the patient that I use for Carl Shapiro. And it came from the GI bleed patient. And
Mhm.
I do the same thing as you, Reed, because I wanted, all of the different tracings that I could get on there. So I
Yeah,
use for the waveforms, I use the monitor. But for this patient, there's your jaundice.
sure. Okay.
So this is the name of this patient. I believe this is NAO, the GI bleed patient.
Okay.
So you'd have to change your whatever your paperwork is from I think that's
Female,
me there that you were using. So yeah.
Yeah,
And then
okay.
he can also you can like for digestion and abdomen,
Mm.
you can make him distended,
Oh, yeah, that'd be good.
right? So you got the abdominal distension on him as well.
Sure.
There's that versus here's his normal and there's his distension. So I
Okay.
give you a good liver patient for you there.
Yeah. And looks like they have all the other capabilities too.
Yep. This is a typical Gen 2
Okay.
and all that. I don't run his vitals off of this. I run his vitals off of the defibrillator, just like you're
Okay.
showing. And I do that, yeah, because I want those waveforms.
Mhm.
So that might be something that we add in the future, speaking to John and Rick,
Hmm.
that all of those waveforms that are available on the monitors could be available for Gen 2. Because then that would actually, what I would do then is I would change this completely. I'd put, because I took the monitor down from in here and did what you did, Reed, where I
Yeah.
put the defibrillator monitor in here, but this gentleman actually, he goes from congestive heart failure into cardiac arrest.
Oh, okay.
And so they have to work a full cardiac arrest for about 5 to 10 minutes. They work a full cardiac arrest. And I essentially take him through what would be an ACLS
Sure.
mega code, more or less. But I just do it, there's your shyness, Brady. Um I just do it manually.
Sure.
So, and yeah, you're right, kind of switching between these two. There are sometimes I'll forget and I'll be like 70, set the
Yeah.
values, and I'm like, oh wait, no, never mind. You know. Um,
Yeah.
but yeah, just getting used to how that worked. That was sort of where I was at. So,
Hmm.
yep.
Sure. Okay.
So there you go. That should help you out at least with the that patient. He is
Hmm.
jaundiced. So
Yeah. Okay. Yeah, we'll have to make some changes, but I'll consult with the faculty. The only other thing, like in my role, like technically, and this I'm not throwing blame at them, they should have probably made all the sims and stuff because it's for their course.
right.
Um, and I wouldn't say my boss wasn't happy with me, but she was like, they need to do it. Like you can't do like say yes every time. Just like I have a nursing background, so I'm like, yeah,
Mm-hmm.
I know what to do for that, right? But um, so in the future it'll be them led, and I think really I'll just be building it. But because I think our third semester faculty are probably going to latch onto this for this similar clinical makeup. It'll just be like 2 patients instead of 4, and then I'll
Yeah.
have to do another thing. But yeah, so
No, starting off, that I completely understand. Because starting off, I was doing 100%
yeah,
of everything because to get faculty to buy into it,
yep,
you can't be like, okay, you're gonna have to do all of this work and then I'll do all of this work, and they're like, yeah, but I've already got all of this work that I'm doing too, like I'm adding this on, and then inevitably comes up, oh, am I gonna get paid for it, those kind of things. So no, you're doing the right thing. I mean, you know and then once you get them into it and interested, then yeah, they're willing to do, they're like, oh yeah,
mhm,
I'll do it, that's a lot of fun.
yeah,
And but it takes time. So
yeah. So I'm hoping this. I like presented it at their first faculty meeting before the semester started, and they all seemed pretty um interested. And I just for the longest time they were really I wouldn't say against VR because no one was there to facilitate it, and then now I am with this role. So, but I think some of them still have that mindset where it's like I don't know, whatever. So I think it's finally starting to curb with
yeah.
them.
Excellent.
A lot of people hated simulation when simulation came out
Exactly. Yeah.
originally. I mean, who
Sure.
did? They were just like a rubber mannequin. Oh, that's ridiculous. Where you go to clinicals and now we just wouldn't live without it, you know.
Right. Yeah.
And so I'll get that too, where there'll be people that are like, I don't really want to do this, but then they listen to the other person that did it like last semester, and they're like, oh wait, I didn't like. So I have two instructors right now that are using the birthing mannequin in their lecture class rather than using it just as a clinical. They're using it in their theory classes, and so what one of the instructors does is she has the student come in and they go through an entire delivery
Mm,
before they have any of the class. Like they've gone through none of the class. And then they go through a debrief after that. And it's kind of neat to do it that way.
mm,
And the students loved it. They thought it was great. They're in lecture class and they're not listening to like a lecture with a PowerPoint,
right.
and so they loved it. And she was talking about it so much to everybody else that another instructor's like, well, can I do that? you know? And she's like, we'll get in touch with Bill. And so now I've met with that instructor and we're doing that this semester as well.
Cool.
You know, so it comes. And then they get really excited about it and they start talking to everybody else and, you know, it definitely comes.
Same
Yeah.
will happen with
Yeah.
students too. Like sometimes we'll hear that, the students get excited about it and then they go to another course and they're like, why can't we do VR like we did in the other class? And then all of a sudden that
Yeah.
instructor's like, hey, how does that work again? My students are asking about it.
Yeah.
Mhm.
So yeah, I think the students have started to buy in, even just like doing like the hazard experience or whatever. Like it gets them out of the classroom and it's less, uh, a different change of pace rather than
Yep.
just sitting there like for 4 hours or whatever. So, same with the immersive room, like they can get up and come in and do whatever and go from there. So, um, yeah, can I share my screen one more time just to show like
Yeah, please do.
so I tried to mimic like the OER sim outline kind of thing the
Mm,
best I could with
mhm.
this. But just so like, yes, I'm going to be facilitating it, but like if a faculty had to step in and facilitate, ideally they could do it. That's what my hope was here. So
Mhm.
like, it has like the general stuff, like how long it should take for each session, whatever. Um, I made some learning objectives and outcomes, but then they actually like pulled them from their course. So that's what these are. They're like straight from the 115 course for what they should thing. And then like generally like sim manager wise, like what sim it should be, what's happening, the initial settings. So this is kind of mirroring the OER setup. And then I'm
That's
gonna
great.
type out like a actual like word for word spiel for the pre-brief person, the facilitator to say, but this is essentially like everything that they should hit on, like general VR use, safety, look up their patients, report, whatever.
Mhm.
Um, so then I have them broken up into 3 stages, like I said, where I tried to, and I'm not completely done with this yet, but I tried to have it this patient, the overall goal of this stage with this patient, what the student should be doing during this stage with this patient. And then these are like the avenues, like I talked about before, like, if they actually ask the patient about their discharge plans, they're going to say they're a single dad, and that's why they've developed diabetes because they can't afford a better, diet, and they're really scared to go home and now have to manage this with their son who they take care of by themselves.
Mhm.
Or this person who the liver person, they were just admitted a month ago for this for a long time, and they refuse their furosemide because they're scared that they're going to be here for a long time and it's more anxiety driven. But if they don't ask about that, I'm not going to divulge that information. Like I'll bring that up in debriefing, like, hey, these are things we probably could have done because this is what would have happened. Um, but that's the hard part about using just like a static table, because I don't know what the student's going to say, and I the facilitator, I guess, has the freedom to kind of take it however way they want, but I want it to be consistent at the same time. So, and
Mhm.
then from a facilitation standpoint, I was hoping to have like the changes for the sim manager, so they're in one spot, like this is what their vitals should be after the patient or the student interacts with them, like after they give them a medication or something like that, so it's very clear. Because what I'm thinking I'm going to have do is, like, Rick, I asked you if we could get access for our instructional assistant for nursing, not to run the facilitation but to be like a, a background facilitator, just to
Right.
change the vitals. Like that's
Yep.
it. Just so I can, because since if I'm evaluating the student at the same time, it's real hard to manage 4 patients at once and respond for all of them and change their vitals. So if I
Well,
could,
I hope there's a tip we're gonna be able to share with you that's gonna make that a whole lot easier for you.
okay, that'd be awesome.
Yeah,
Um,
but I just want to comment also that this, I always believe that it's 80% planning, 20% effort.
yeah,
That, mapping this out makes the build so much easier, because there's been so many times I've been in with clients and they're kind of making it up as we go along. And you know, if you're not kind of in control of the scope a little bit, it can get crazy and then you're in there for hours.
yeah,
But if you go in knowing what your objectives are and with some guidance, you know what you need and you can make it happen pretty quick.
yeah. So I agree. That's why I tried to, because like in facilitating some of the OER ones, like I knew like it has to be structured, otherwise the potential like this especially, they're going to be in the headset for 3 hours then, and that's not doable for both of us probably. So like I tried to make it as structured as possible, but these are the things that are probably gonna, if we notice a student is always missing this part, like maybe we have to add a patient queue in here or something, or whatever, to stimulate them to ask them something or whatever. So yeah, that's what I tried to do for this. But and then, like I said, we have like the Mars for everyone. Like these are all posted in the room, and then the HMPs. This is what they get before to like look up their patient and stuff. So yeah, that's what took the longest, was transcribing all those. That's what I had help from our instructional assistant. She I showed her the vision, and then she kind of typed them up. So
Great.
yeah.
Yeah, no problem getting her an account. That's
Yeah.
great.
So
And if you need any support with her training or anything like that, let us know.
okay. Yeah, she's in her role, they're not allowed to evaluate at all or anything. So I think the scope is probably like, and they're not in a position to be like a sim tech really either. So this is just like a one-off, like, hey, I'm going to show you how to change the vitals or whatever, and just help me out with this for, twice a semester. So, but yeah,
Right.
we'll keep an eye out for that. So,
Going to share my screen. So we've got this new feature, and you'll find it in your assets under the utilities where you find the image display viewer.
okay.
And it's, I call it the toggle widget. It's the toggle something. I call it the toggle widget.
Okay.
But it's a real simple, but really powerful function that allows you, it kind of works as a mini sequencer. So in this case, it really came up because we were being asked about, hey, we want nurses to find a patient on the floor and get them back into bed. Well, there was this very kludgy method we would have of doing that, about kind of recording, turning things on, turning things off. But with the toggle feature, you're able to select assets in a scene, toggle them on, visible, off, invisible, or just select it toggle. That just means whatever state it's on, turn it to the other state. Right? So if you hit the button multiple times, it can go off and on.
Yeah.
And so in this particular case, and this is again just a sample, come in, we found the patient on the floor, we do an assessment, we want to get her back to bed. This holocron, this button, is actually that toggle widget. And so I've attached other things that are in the room that are toggled off right now, so that when I click on the widget, I get another widget up here, and I get this video that comes up that shows about the procedure for using the lift to get the patient back to bed. The idea is the nurses would watch, or the students would watch this briefly, right? Because there's this transition that we have to make from the floor to the bed. So they watch that, and then when they're done, we can just click back to bed, and boom, Millie's off the floor and now in the bed. So in your case, where you're like, okay, the patient has gone to the OR, you could put a widget in the room, the toggle widget, select the patient, that when that button is clicked, the patient's gone.
Dang, okay.
They've left. But there's so many other uses, right? And another one I thought of, I think you had mentioned giving a med and the patient decompensating. So you're also, I mean, again, same concept, where instead of individually toggling the vital signs, like you're mentioning for the students, you could put a whole second patient in that room that's toggled off with the vital signs you're looking for, that when that button is pushed, right, the initial patient is off and the new patient is toggled on. And with all the different vitals and assessment settings already set for that patient.
Okay.
And
So is that like a sequencer kind of?
It's I think of it like a mini sequencer.
Okay.
But you can kind of add as many assets as you'd like to this toggle feature so that, I don't know, you wanted a code cart to suddenly appear in a room, or an IV to be up, or, you click one and make several things happen at once.
Sure. Okay.
Another example, and this is just, again, something I've been playing with myself. Let me find it. I'll put it in quiz room too. Another example, we've been getting a lot of requests about mental health, dealing with mental health patients,
Yeah.
helping nurses identify escalations. And so this was something I've played with, have not finished it. This is work in progress, but these are all toggle buttons. And so it kind of goes from, okay, here's patient anxious, patient agitated. And the idea is, you would identify what's different, right, in these patients. Why do they look different? And then aggressive,
Dang.
or, we can kind of show all to kind of get a scale.
Uh-huh.
And again, I'm playing with this right now, so this is kind of just a work in progress. But you can see how I have multiple patients in the scene, but you don't see multiple patients until I click those buttons. And then suddenly things about this same patient have obviously changed.
Yeah, this is I mean, this concept, our mental health class would for sure probably latch onto this. Like what this is. That's really cool. Okay.
Yeah, and what I wanted to do is actually have a panel behind each one that also comes up that kind of describes, okay, anxious, look, very quiet by themselves. They've got a comfort measure. Maybe they're a little pale. They're scanning the room. Agitated. Now they look, they're up. They won't look you in the eye. They're sweaty. There's moving, back and forth, and then aggressive. Change the skin pallor to ruddy and angry, and because we do have those settings for some of the characters. So
Yeah.
but this was really also an example to show, hey, same patient, but you're able to show them in different states.
Yeah.
In this case, it's biological manifestation in their psychological state, but you can do that with vital signs also. So if your patient got their med pushed and you want them to show, suddenly they crashed, like you had described, or what was it, the fluid in the lungs, you can click a button and boom, what you've done is kind of hidden the first patient, showing the next patient, but all those vitals are set the way you want.
Yeah, that would make facilitation a lot easier.
Right, one button instead of kind of, let's move all these sliders.
Mm-hmm.
So,
and that's in there now?
It's in there now under the utility sort, right where you would find the image viewer, and I know you use that a lot.
Mm-hmm.
So, but I think if you do a search for toggle, you'd find it.
Okay.
But I'm glad to get in there with you sometime and play around with it.
Yeah, I might need some direction.
Once it clicks with you, you just start, oh my gosh, there's so many things you can do.
Yeah. Dang, that's nice. Yeah, that opens up a lot of different, like even like this one, that opens up a lot of different, like assessing multiple patients at, I don't know, like at different stages of their treatment or something like that. Like, I don't know, like someone has congestive heart failure and it's the initial one is they're really edematous and super high blood pressure. And then the next one is they've received their IV furosemide and now they're urinating a lot. I don't know, their lungs are clearer.
Right.
So.
Exactly. And that's what I did here with this patient. I mean, it's the same character, but in obviously different states, right? Whether they're pale or whether they're sweaty. I have this guy kind of mumbling to himself. I put the talking feature on.
Oh, sure. Yeah.
Right. And then this guy with his arms crossed and the angry scowl and kind of staring at you. And so those things that you can change, again, same character, but all these features have been changed.
Sure. Yeah, that's nice. Yeah, I'll have to play around with that. Interesting. Okay.
And to trigger, I like the last example with the patient on the floor, where you can also trigger kind of help things in the room, like that video that comes up. Like, well, we could magically put her back in the bed, but let's not skip that there's a big process in between, that's happening.
Right.
And we can't reflect that in VR, but let's just show a quick 2-minute video loop.
Right.
So you kind of know what happened and how it works. And then she's in bed. Now let's assess her further.
This might be like unrelated, I guess, but like it is the process of making like a sequence very time intensive. Like could I do that, or is that more of like the developer side?
You mean like a sequencer, like we have those panels?
Yeah, like with the respiratory one, where they whatever was in that 4-bay to start, there's one of those that was a sequence.
Yes. Yeah, that's on the developer side.
Okay.
But again, I think this function gives us a little bit of that, because again, you can, and you can have multiple toggles. So you can have different things happening. I've even imagined having toggles through a ACLS algorithm.
Yeah.
You could actually toggle your way through that.
So
Yeah.
Turn
Reed,
things on and off.
we did the sequencers at Madison, and it can be time intensive.
I believe it.
And there's obviously an expense to it as well. For us, it was great. Like, because I was running it by myself and then also acting as the partner to the student as well. When I was doing clinicals, I had a 6-patient clinical, so a 4-bay and then 2 that they saw elsewhere. Back in November of 2020, when I was doing that with my students, I was acting both as the patient and then as their partner. And man, that was like, whew, I got through it, but there was a lot of like, oh, okay. Um, and so we went to doing the sequencers. The first one we went with was the ACLS, the dynamic cardiology, and then we have an opiate. We have obviously the birthing sequencer is there as well. But then we have the asthma CHF COPD, which could be helpful for you. Um, I think that might be the one you're using, is the asthma CHF COPD. That was our respiratory therapy program. And then we also have the opiate sequencer as well. And there's some behind the scenes to it as well. Rick, I'm going to share my screen just for a second
Yeah,
here.
let me stop. Yep.
No problem. I'll show you sort of the behind the scenes to it. And actually it might even help you out when it comes to the sequencer. So we had the sequencer template, which was sort of like, here's what our expectations are. So and then everything that's going to be, sort of in that sequence. And then it was the values. So the values were the next thing, and I laid it out in an Excel format because that just kind of worked better for
Yeah.
people looking at it as well. Because then they were like, okay, here's the return from surgery. This is what we're looking at, and all of that. And then this is what we wound up sending to Acadicus to have them create, and just utilizing all of this information. They then created that within. Yeah, it's time consuming. There's obviously an expense to it as well. But if it's something that especially when you're trying to manage 4 patients, and if it's something you're really, really looking, like you're going to keep doing this for a good period of time, it really is a good investment.
Mm-hmm.
Sure. Yeah, it looks like whatever you just had up, like that's kind of what I tried to make. But it was just in like Word. It was kind of sloppy. So yeah, that's but if
I
we could use the toggle feature, I mean that I just auto do it then, right?
Yeah, and the toggle feature, yeah, your work behind the scenes will be a little bit more, but like Rick
Yeah,
was saying, you're using it as a mini sequencer, and that works great.
sure. Interesting. Okay. Yeah, I'll have to try that out. That seems like it'd be really useful.
Yeah, and again, very simple function. You probably wouldn't even need my help, but if you wanted to get in there together at some point and look at it, hit me up and we'll jump in.
So if you like place it, does it just offer you like various tasks it can do?
Yeah,
Or
think of a button, and then underneath that, there's just a check, an add, a plus sign, and you click that,
okay,
and it goes, what asset in this scene do you want to add to this
mm,
toggle button? And then you just click the patient, and then it offers you three options. Do you want it to toggle? Do you want it on, or do you want it off?
oh, okay,
That's it. And you just, for whatever you want that button to function, you like that example where I had the patient on the floor and then in the bed. There's
yeah,
actually two patients in that room and two beds.
sure,
And I'm just turning one pair off and one pair on using that toggle button.
interesting. Okay, yeah. I mean, I would be willing to, like you said, it would take a little bit more time on the back end, but if that makes that would really make it easier. If like anyone could probably, any of the faculty could probably facilitate then,
Yep.
if needed. I would probably be doing it, but yeah.
Yeah. Then it's just a button,
Mm-hmm.
meds pushed or whatever,
Yeah,
whatever you want to call it.
yeah,
And something I'll recommend too, if you're going to put a holocron in the room for that button, make it only visible. Well, I would say make it only visible in edit mode, but then you're probably going to have to be in VR to do that.
yeah.
But make sure you put it somewhere where the students aren't going to see it and find it,
That's what I
because
was worried about. Yeah,
they will push buttons like crazy.
but yeah, I don't blame them.
I, I have a CPR and a BLS, or CPR and a BVM button in that one that I showed you, and I have moved that thing. I can't tell you how many times, and they keep finding it, and I'm just like, stop, because
Yeah,
they're like, oh, we got to start CPR, and I'm like, nah. They keep putting it. They keep finding the darn thing.
yeah,
So what I finally did was I put a screen in there, right?
hmm,
And it's behind the screen. So like they would have to go back behind the screen to actually find it. So you can
sure,
even just put an asset in there that looks like it would be part of that simulation, and put it back behind it where like only you really know that it's there, or only the facilitator really knows that it's there. That way you don't get them hitting that button, because man, they will.
like behind the like the orders and the MAR and stuff I have in the room. Could I put it right behind that?
Mhm.
Yeah, you could do that.
Sure.
You could do that. Just make sure that you can reach it from non-VR mode,
Oh,
you know?
sure.
So like, anything, I mean, if you put it behind the couch, just make sure you can get back there in non-VR mode and hit it, because really all you got to do is be able to see it, and then you can click on it. Unless you're doing, if you're facilitating from VR, then you can put it wherever you want and just make it invisible, and then
Mm,
you go into edit mode and then you hit it. I will say I have messed up some things doing that,
yeah.
where I've gone into edit mode and then I go to hit this and I grabbed this or whatever, and that's dangerous. But yeah,
Great news on that, Bill.
yeah,
Sean told me that he's hoping this quarter to release a locking function for assets.
excellent. Yeah, that's
I
what we
was
need.
like, "Phew, man,
Yeah, yeah,
that is such good news." I
Yeah.
mean, wow.
yeah. I can't tell you how many times in edit mode I've accidentally pulled something and been like, oh no, right in the
Yes.
middle of a scenario too. The students are
Yeah.
like, Why did the bed just go upside
Yep.
down?" You're like,
Yeah.
never
Yeah.
mind that, never
Yeah.
mind that. You know.
Yeah. When I'm
Uh,
building, I'm just to the point where if I change something, I just get out of edit mode, like
Yeah,
muscle memory, because I've messed it up too many times.
yes.
yeah,
Yeah.
So
yeah.
Or it's
I
like
make
you nudge something 1 inch and you go, save, save.
yeah, I do that. I save it
Yeah.
I
Yeah.
make
impulsively.
everything. I At first I make, if I'm putting a new asset in, at first I make it hand grabbable, because
Mm,
I'm not good at operating So I just make it hand grabbable. That way I can now go into learner mode, and now all I can mess with is that thing. So
Yeah.
now,
sure.
like if I've got a bed and I need to move it around or something like that, I can move it around in learner mode, and then I turn around, physically turn around, go back into edit mode, touch it, save it, and then move on from there. But yeah, I'm with you, man. I there's a couple times where I'm going, oh no.
Yep.
As a matter of fact, I think if I go
Reload.
into our EMS delivery, I do believe that our patient is floating about 3 feet above the bed, which is kind of interesting. So I still haven't corrected that, but
Is that the possession scene, Bill?
yes, yes, yeah, yeah, yeah. I'm like, is this the gatekeeper from Ghostbusters? Is that what's going on here? Um,
Yeah. I mean, back to the toggle thing. Couldn't you just make it like really small, like and put it in maybe in
Yeah,
like the
you can
corner of the
size
room or
that button
something?
however you like. It's like
yep,
any other holocron, any other
Yeah.
asset. Yep,
yep,
Interesting.
yep. You
Okay.
sure could. And
Huh.
yeah, hide it behind
tiny
something.
little
Put
thing
it.
if you wanted.
You
Yep.
know.
Okay.
Yep.
Yeah. Um, I remember before you asked about limitations or whatever, Rick,
Mhm.
one of the other things I was thinking of was um, with that second patient, the fracture or whatever,
Mhm.
the main goal for the student is for them to give them their IV antibiotics. Like that's like their task for that person. Um, I got the vial of ampicillin. Is there like an already built sequence that mimics like an IV push something or something like that? Just because otherwise they have to bring the vial in and be like, I would draw it up, but there's not like a object
There,
or something.
there, there is not, but you raise a good point. Let me mull that one over.
Can they ask someone else to do it, or do they actually have to push the med?
Ideally, I wanted them to do
Okay.
it, but I don't think that exists.
Yeah,
No.
because what I was going to say was like I have where in the cardiac arrest scenario the student will say, okay, let's push a milligram of epi, right? And then I hit a recording, and that
Yeah,
recording
okay.
comes and pushes that milligram of epi. So I didn't know if it was something where they could do it. There is a plungible syringe in
Mm,
there, but the problem with the plungible syringe is like you can't set it to where you want it in terms of the milligrams
Milliliters.
you're giving and stuff like that.
sure.
And it's the plungible syringe is for the for intubation. So
Oh,
it's a little bit bigger syringe than we're probably using for most of our meds.
yeah.
So but that's the only those are the only
Yeah.
things I can think of. I do have
So,
to run, guys, so I'm gonna
okay.
say goodbye now.
All
All
right.
Take
right.
care.
Nice
Bye,
seeing you,
Bill.
Bill.
Thanks.
Um, yeah, I was gonna ask about that at some point too, like because they would really like some, I think we talked about this last time, like skills related scenarios like the Foley catheter one or whatever that's like kind of self-paced. Um, and I think the last time we met, that was the first time I was really building and I made like an IV room or something like that.
Right.
Um, but like I had all the supplies in there, but there's not really an option for them to like
Right.
put the IV in
It,
or
right.
push the med or whatever. So that's was something I was going to ask. But
Well, if you have these things that you're thinking you'd like, share them with me. Shoot me an email and say on a skills perspective, here are the things nursing's asking
oh,
for.
okay.
Let me
Yeah,
know. And then we can look at that and see what we can come up with.
sure.
If starting an IV is one of them, because
It
we have
def
to figure out also how does that work in VR?
yeah. Like obviously it wouldn't be the same as real life, but even if it was just they have to pick it up and place it in the socket spot and then it pushes the needle in
Needle in. Yeah.
and then they have to grab the the needle from the cannula and remove it out of the socket
Mhm.
spot and put it on the sharps. I don't know, whatever.
Mhm.
Like just the steps. I think another method of doing the steps rather than just staring at the checklist
Yes.
would be
Yeah.
good, even if it's not perfect. Like the Foley one. Obviously, it's not like super realistic to real life, but it's the steps
Yeah.
of doing it,
Right.
So yeah,
Yes. Shoot me that, and I'll be glad to kind of talk to our dev about it and see what we can make happen.
yeah. I'm gonna meet with my boss after this, and maybe we'll try to make a list, like not like a crazy long one, but like 4 or 5 skills that would
Yeah.
really
If
be
we could have
beneficial.
this would be great.
hmm So yeah, and then I would apply to this makeup scenario as well. So um Yeah. So I don't know. That's where I'm at with that so far. Like I said, it probably is the exception because it's probably one of the largest asks that could be asked of me for this job because it's such an expansive like force sim kind of thing. Plus I had to make it all myself, which probably won't be the case in the future, but it took me like probably 3 weeks to make and it's not really done, it's kind of done, but from start to finish, and that was with help. And if I didn't have help, I would not even be close to done. So yeah, but I think it looks okay.
It's fantastic, man. Great work, seriously.
Thank you.
And I think now that you've done this and gone through this one, man, anything else you're gonna have to do is gonna be cake. I mean, it's gonna be. I mean, you kind of started with the Titanic a little bit, right?
Yeah, I know.
Let's do the most involved one with 4 people and 4 beds and, a lot of stuff in there.
Yeah.
A heavy scene.
Yeah,
So,
I know. So,
yeah.
but then, like I said, the third semester group is probably going to latch onto this, but then it's only going to be 2 patients. So that'll be like, well, that's a vacation. I can do that
Yeah, I can do
tomorrow.
that, yeah. Couple hours, boom, you're done.
Yeah. So,
Again, I think you start playing with this toggle thing, you're gonna see a whole new set of opportunities open up for you.
yeah, that seems like it'll make life a lot easier.
Yeah, definitely.
So, well, maybe next week. I don't really have a lot of time because I start teaching clinical next week, but I'll try to get in there at some point
Yeah.
and
Yeah.
play with that, and then I'll let you know where we can meet and I can show you or something. Or
Yeah, let me know. Thanks for joining us today, Rita. Really
yeah,
appreciate. And hopefully you've gotten some tips and some things that'll help you moving forward.
yeah, it was nice to hear because like obviously I don't like I've spoken like with Mitch a little bit and Jamie
Right.
and stuff, but not really questions from like your side. Yeah, like you and John. So like I've
Yeah.
only had questions from the faculty. So it's nice to hear like the Acadicus perspective questions rather than the content specific faculty questions. So
Yeah, so we do this every Friday at the same time. So
oh,
that
okay.
link, if you ever just want to drop in, feel free.
Okay.
We
Yeah.
consider them open office hours, really.
Oh, sure. Yeah, I think most Fridays I'm fairly open, so I probably could. Is it like is there like an outline? Like I know this was kind of like planned for me to do this or what? Just
It's
like chatting.
really, it's just chatting. Again, it's open office hours. We let all of our users know that we're available and they can drop in. Usually if there's nobody that joins, then we pick a topic that we go over,
Hmm.
how to do something in Acadicus, and John records that and puts it out on our site.
Okay. Sure. Interesting. Yeah, I'll do my best. I think that's beneficial because I mean for the longest time, I met with Mitch while when they were still at NWTC, and then I went and saw Jamie for the grand opening thing last semester, and then I know we chatted a few times, but yeah, I've kind of been solo doing this, so it's nice to hear from
Yeah,
other
we're here,
people.
man. Yeah, we're here. Don't feel alone.
So
We'll
okay,
jump in
yeah,
there with you.
I'll try to join those. That was good. So
Great. All right, my friend. Thanks again.
yeah,
Have a great weekend.
you as well.